Welcome back to Thinking About Therapy. Today's episode is all about physiotherapy. I'm delighted to introduce Stephen Mc Kendry, who joins me today. Stephen is a chartered physiotherapist and the owner of Your Physio, a private physiotherapy clinic based in Derry in Northern Ireland. So Stephen, thanks for joining me and being open to having a conversation about therapy. I feel like there's so much that we could cover and it's difficult to know where to start, but maybe I could start with some questions that we had submitted and perhaps that can get us going.
Yeah.
So are there different types of physiotherapy? I feel like that's a great question because I don't know the answer to that either. And the second part of the question is, how would you describe the therapy element of physiotherapy?
Yeah, so there's different core areas of physio. Like there's so much you can go into as a physio. It's endless. But when we learn at university, there's my area is musculoskeletal, so that's the area I specialised in. But in the hospital, there's neurophysios and neurological physio who deal with strokes and Parkinson's, things like that. Then there's respiratory physio, there's pediatric and orthopedics. So there's different core areas, but even within them areas, you can go into different parts. So there's so much you can go into. But from my side of it, I was always interested more in the musculoskeletal from when I was, even before I went to study physio, just because of the sports element of it. That's kind of got my interest. So I decided very early on that was kind of the way I was going to go. And the areas that I kind of specialized in, then I did courses afterwards and kind of learned from different people to get that experience in that area. So that's kind of where I went with it. You were saying then about what my opinion of therapy is. It definitely means a lot of different things, but for us, like we obviously the physical therapy is the term, but we have to look at everything. So I think therapy is, if you look at someone who has a need and we're there to kind of guide them back to where they want to be, really. So we need to find out where they need to be and how we can get them there. So, and that's not just physiotherapy, that's everything. We're there just to help them. On our own, we can't just magically click something and that's it sorted, which physio, sometimes we get the opinion people can walk in and we can crack their back and they walk out and they're 100%. But it's not that. We have to give them and educate them on how they have to look after themselves to make sure it doesn't keep coming back, or to let them know that this is going to take quite a long time, which I'm sure is probably similar to you. You have to kind of break things down and say, look, after today, you're not going to be feeling 100% straight away. And it's a bit of a journey you have to go on. So for us, it's the education. Yeah, the education side of it has become, it's even bigger now. There's a lot more evidence in physio to kind of get us away from doing too many passive treatments where we're focusing solely on just doing like manipulations and treatments like that. That we are now starting to empower the patient and educate them a wee bit more. So that's the kind of area that's developing a bit more in physio as well.
Yeah, educating somebody about the larger issue rather than, because I think you're right. You know, you said it there at the start. I think a lot of people do have that perception of like, I'm just going to walk in here. It's going to be one appointment. You know, you're going to pop something or crack something, and I'm going to walk out feeling fine.
We definitely get that a lot. You know, people do. They'll walk in and they'll say, "Can you pop this muscle in for me?" And that's physically impossible. But you know, so you can't just say, "Look, that's physically impossible." Out you go. You have to kind of you have to sit them down and say, "Right, this is the reason," and break it all down. Try and make it a wee bit easier to understand, and then tell them what's needed done. So, but it takes time. I think you have to really read the person as well, pretty well, so you know how to describe things to them. Because if you go into too much medical terms with some people, it's absolute nonsense to them. They don't want to hear it.
In terms of like your assessment, then is it the same with everybody, the initial part of it, or does it depend on what somebody comes in with? Or
No, my assessment initially when I've never met somebody before is quite conversational. Actually, I don't really, I have a structure and I know what the kind of information I want to get, but I do let them talk for quite a bit. Sometimes they give you more information without really realizing it. So I kind of ask them the basics initially, and then whenever they're talking, I kind of maybe direct and ask them wee bits about what they've told me. But we break it down. The subjective is when we just speak and chat to them. So we would ask them questions based on their injury, the history of their injury, their past medical history, which for us is key because they might not realize if it's something they have now, might have been because of something that happened a couple of years ago that never addressed, or different injuries that have developed over time that have created something else. So we have to find out what's happened before this. If we just looked at the injury now and just treated that, and there's a good chance if we haven't looked at the rest that it'll just come back So we're not really addressing the problem. So we have to look at the whole picture. So having a good chat to them at the start is important. I also think it's important to build a bit of rapport with them, so I don't sit there and grill them and just kind of just try and get information and that's it. So I try and have a bit of crack with them, try and chat to them. A lot of people come to us are maybe a bit apprehensive. They don't really know what to expect, so they might be a wee bit stressed about it. So I try and ease that very, very quickly. So that's what I do initially. We sit down and have a chat. With the information they give me, generally by the end of that, I'll have a good idea. I know of what their injury is. The objective test that I do with them is pretty much just to confirm what they've told me. So by the end of what I've spoken to them about, I should know what's going on. The test I do, they will confirm it, and then we sit back down and we talk through a treatment plan and where we go from there. Really, so that's an initial assessment when somebody comes in. That's where we start with.
It's really interesting to hear you say that having to build a rapport with somebody is so important, because I always say that in my role, like as a psychologist, I always say this isn't going anywhere if we're not getting along. And I think like that, it's just interesting that in your context, that's such an important part as well, that relational part of it.
For me, it's huge. I think it's something I've always kind of worked on, the communication. For me, like any physio's ever worked for me before, I spend a lot of time with communication. But part of it is that to build that rapport and the trust with the patient. If they don't have that, you could be doing everything right and you could be telling them all actually the right stuff 100%, but they're likely to leave there and not do what you've asked them to do, or they'll not come back to you because they don't have that kind of rapport with you. So I think if you're going to have a successful treatment with somebody, you have to have a rapport with them, build that trust, and then they know when they leave that they're absolutely going to stick by what you said. They trust what you've said. So
yeah. As I said, it's just interesting that that's the same, in your context as
well. For yourselves.
Yeah. And I always say if it's something's not working in therapy, the first thing I do when I'm thinking about it is like, what's my relationship like with that person? And and I always put it that, just as we relate differently to different people that we meet in everyday life, we'll also relate differently to different therapists.
Yeah.
So sometimes I'll say to people, maybe it's, it's you and I aren't getting along, and it's not a bad thing, but here's somebody else that you can work with or whatever. But I think the main thing for me is that relationship is so important.
Yeah.
If you don't have that, as you said, then they're not going to buy into, what you're asking them to do.
Yeah, I use it for, like, if I build a good rapport with someone and then a couple of weeks down the line, you say in the first few weeks they're really chatty, say if their injury isn't quite, or they're getting more frustrated with it, or if there's anything happening with it, because it's not always straightforward. It's not always that they're going to make 100% improvement straight away. It takes time. But if you get them in the first few sessions, they're really chatty with you, and then suddenly they come in and they're not as chatty, and they're not giving you as much information, you can read that very easily to say that I'm getting a wee bit frustrated here without them actually telling you. So I always use that to kind of gauge them, and then I would say, right, look, I can tell you're a bit annoyed about the injury. What's going on with it? And we have a little bit more of a chat about it. Whereas if I let that develop a wee bit, then again, it's going to go back to the point where they're not going to do what I tell them because maybe they're not getting where they want to or expect to be at that stage. And a lot of times with someone like that, we just sit down and say, look, this is completely normal for this stage of your rehab, and it just takes longer. And if you buy them back in and they can understand where the science is behind it, then over time they will, like in the next few weeks, they'll start seeing the change again.
I suppose that's one of the things I was going to ask was for you, where's the kind of psychology in it? But I think that's kind of, from what you've said, that sounds like that's the psychology part of the job as well, that having those conversations and getting.
Yeah, the psychology part is massive for us. Like it without actually training wise in university, we didn't get much training in it, to be honest.
Okay.
So it's something that I've developed through courses, not specifically in psychology, but different courses where they talk about it. And then just from working with patients and seeing areas that I've maybe looked back on and thought, what happened with that person? And in the past, I maybe have read someone's body language and tone of voice and thought they're not happy, and I didn't say anything. And the next thing, the patient doesn't come back, and they may just leave their injury rather than actually going and getting better. So I've got better over time at just reading people. But we get people, it's the same as you, like you'll probably see people who have issues, mental health issues, who are not exercising, who then develop injuries because they're not doing that. So we see the same people who are getting injured who can't do their exercise, which normally manages their mental health, and we're telling them, for now you can't do this, but we have to try and find a different way that they can do it. Otherwise, if their mental health goes downhill, everything else will as well. So we have to try and find a way around to kind of manage mental health as well. definitely.
Yeah. Yeah, I think one of my first experiences working with physios was a teaching kind of module that I did on my own training. I had to go in to teach a first year physio class.
Yeah.
And yeah, it was a very basic kind of CBT concepts, but I suppose what I found when I came away was like they wanted to know more, but I'm not really sure that input was always there.
Mm.
And I think it takes the way that you said it, to kind of go on other courses to kind of, and maybe not directly psychology related, but to give you that psychology aspect of it as well.
Yeah, I think it's great. I think it should be incorporated more. It is getting better now. I don't know if maybe they do teach it better in universities now, but because it's becoming the biopsychosocial model of rehab is massive now. So like I do think that they need to incorporate it more. So I hope that it is kind of being brought in a bit more than it was.
Yeah. How much do you think that kind of the mindset of people coming in impacts like on the ability for you to work with them or for them to get better?
That's huge. We would see a lot of injuries we see, and there's a lot of studies they say this, that a majority of injuries we see are actually because of someone's fear of doing a certain movement. So you may say if someone came in with a back injury that flared up, they'll then stop doing the movement that triggered that back pain. They'll become very, very protective of it. So they'll stop going for their walks, they'll stop lifting their children, they'll stop doing basic fundamental stuff day to day, which obviously is then going to have a massive knock-on effect to the rest of the body. So when they come into us, we have to show them, look, this is actually okay to do this, and we give them techniques to manage it, and then start phasing them back into it. But my focus is always get them back to just fundamental basic daily life, just get them doing well throughout the day, and then we build on that, because you'll see this yourself, but if they can't do some of the basic things, then it's going to have a huge effect on them then.
Yeah, that's really interesting. Like way of looking at, yeah, I didn't think about that fear of actually doing the movement. And then the secondary impact of that, as you say, if somebody can't, if it's a, like a grandmother who can't lift her kids because of it, then that or grandkids, sorry, if that keeps happening over and over again, and that's going to affect her mood and things like that as well. And
Yeah.
yeah.
Yeah, well, I had someone recently who was scared to lift his newborn child because of his back pain. So like that's obviously going to have a huge effect on the child and the father, if they can't get that in the early stages. So I had a couple of phone calls with him and sat down with him and just said, look, this is completely fine. Got him doing exercises to show him that it was fine, and he is doing it. He's fine doing it, but it shows that without that he potentially wouldn't have been doing any of that, which isn't good for them. So it's definitely important.
Yeah, and I suppose that's maybe not something that a lot of people recognize.
Yeah.
Yeah, that's really interesting.
Yeah, it's definitely for me that's something that's become. I've noticed it more. I've always dealt with it, but I've noticed more how we have to just encourage people that this is like no matter what, that this is fine, and you'd be surprised when you're asking someone to do a movement, say when they first come in, and they don't want to do it, just by chatting them and showing them a few basic things, they're without really doing much else, they're absolutely fine doing it. So I think a lot of it's just to give them that encouragement and reassurance that they're actually okay to do it.
Yeah, and that education, as you said as well, about what if they don't do it, what the implications of that are and stuff like that. And also, I suppose, normalizing that fear that they have, like you can see why they don't want to do it, but like, yeah.
Yeah, and you have to understand why they can't, because you could just sit there and go, look here, you can do it, and that's not going to help anybody. So you have to find out why they're scared to do it, and then just be quite empathetic with them and understand. And sometimes I don't specifically say if they're trying to bend forward for back pain, I don't specifically say, right, this is how you bend forward. I'll maybe get them doing another exercise where they are bending forward without even saying it. And then I'll say, well, we'll go back and we sit and I say, look, you did do that, which is the same. And that shows you can do it. And then we kind of talk through it then. So there's loads of wee things we try and do to try and get around that.
Yeah. And what about kind of like, motivation and things like that? Or do you find, are there times where somebody might be coming to physio wanting help, but maybe there's some sort of psychological barrier to that happening?
Definitely. Everybody will come. They're looking for to get to a certain point, or they have a certain goal they want to get to. So, but some people might get there within 2 weeks because it's quite an acute injury, and there's loads of other factors. But they might get there very, very quick. But then somebody else might come with a real complex injury that's going to take time. Managing that is tough because you have to keep them motivated. You have to manage the frustrations. It will happen, and like any of the physios that come to me, if we're managing anybody, say for example an ACL, which takes about a year of rehab, these are young, fit, generally healthy, who normally play football, normally train. So to have them at a stage where they can't do what they're normally doing for close to a year is very tough. So you're going to get a period of time where they're going to be quite frustrated, and the motivation will drop. So you have to just keep on them. So you have to find loads of ways, short-term goals, loads of things that you can find that's going to keep them going on week by week.
What about this might seem like a strange question, but your own kind of motivation? Like, is it easy to get frustrated yourself, or how do you manage that, I suppose, as a team or individually? My case, for example, if I'm working with a lot of people who have quite severe mental health difficulties, it can take a long time before I'll see any progress. So you can become disheartened quite easy. Whereas if you're working with people who have very mild, in my case, like mental health difficulties, or I imagine in your case, acute injuries, then you'll see that progress a lot faster.
Yeah, I'm a quite an impatient person generally, so I do like to see results, and that's maybe why I'm able to do this. I kind of feel similar to the patient. I want to get them there as quick as they want to get there. So I kind of tell them that. I do tell them, look, I am impatient too, and I do want to get you there. But it is easy to get frustrated. But with us, I kind of have systems in place that we know if something at X number of weeks isn't where we wanted to be, we have somewhere else that we can go with them. So it's never at a stage where we would hope it would never be at a stage where you don't really know what you're doing. You're kind of lost with it. No matter what, if the injury isn't improving, there is options, and we just have to guide them and be with them for them options. I'll never have a patient where I'll say, "See you later. I'm I can't really do much else for you." If I can't, then I know other people that can, whether it's a consultant or whether it's someone like yourself who we can refer on to. There's always options. So that's kind of how I keep myself focused with it and try not to get too frustrated myself as well. You know that there is an option somewhere down the line. Yeah.
In terms of kind of referring on to other, I suppose I'm obviously interested because I'm biased in the psychology side of it, but like what would be the point for you that you would think, this isn't any longer, it's not a sort of physio issue, it's maybe a psychology one?
If we can't get them past, if we can't get the rehab past a point, so if we're plateauing, we have to look at why.
Mm-hmm.
And if there's no physiological reason that they're not improving, that's when we need to look in and address the other issues. So it's the same the other way about. If they're plateauing and there is something physiological that maybe is doing it, we would refer to a consultant to maybe have a look, either scanning it or sometimes an injection to get us past that point so we can push on with the rehab. So I would look at it the same for the mental health. If there's a block or barrier to our treatment that's stopping us from progressing, we need to then refer to get us past that point, which then helps us push on with the rehab, rather than then dragging it on and on and on for weeks and weeks and weeks and not really seeing any change.
I suppose it'd be the same the other way around for me, because I've seen myself in situations, particularly when I was working in occupational therapy. There were people coming and I was saying, like, actually, this isn't psychological. This is clearly like a physical pain that you need to be seen by. And I suppose that's the beauty about working in that team aspect, or having other people that you can refer to.
Yeah.
And I guess that's also part of like having these conversations, is for me to know what you do and for you to know what I do, and so to have those conversations between each other.
Yeah.
Because I think you can very easily, I know that I very much exist in a sort of psychology world. Most of my friends are psychologists. I trained with psychologists, so it's very hard to kind of get outside of that bubble sometimes.
Yeah. No, it is good to have a conversation. I think there's a lot more out there that we still don't know enough about. Like you say, we are in our wee bubble. I like seeing what everybody does. I'm very open-minded. There's so much out there, and I always tell patients, if it helps you, then work away. I'm not the kind of person that would slate. Like, there's other things out there that maybe aren't quite strong evidence-based, but I find if it helps patients, let them work away. So I am very keen to look at other options whenever it comes to that point. Yeah.
You'd shared a story recently. I don't know if you're okay to kind of talk about it. About there was a man that had come to you and he had quite like intensive work.
Yeah.
And I suppose I read that and I was like, that's an amazing example of, I suppose, like both your work and the time that you put in with him, but also his kind of motivation for change.
Yeah, he's great, Cry. I'm sure he's okay with me talking about. He's happy for his story to be shared. It was actually him that wanted the story shared. He wanted to motivate others going through the same thing, which I thought was amazing. So, yeah, he's an amazing man now. So the way it came about, he had been getting rehab through the hospital, and obviously then with coronavirus and different things that kind of phased out a wee bit. But he felt he could keep pushing more, and so they contacted me. Now it's in an area that I don't specialize in, but I know the family, so they phoned me and they asked if I would help. We tried to find somebody who specialized in that area that could help privately, but there wasn't anybody about. So when we phoned them back, they just said, look, can you just get involved until we get something sorted? Can you keep them moving and keep doing stuff? So we said, look, we'll get them started, but if we're not seeing we're getting anywhere, we'll leave it at that. But he's been amazing on this progress every week. It's been unbelievable. He's a very motivated person himself. He's definitely knows where he wants to be, and no, it's good. It's good for me. Because it isn't something I do every single day. I had to kind of go back and read up on different things, and I had to change my techniques a wee bit for it. So, but it's definitely very rewarding when you see where he was a year ago. He wasn't. He stood, but with a tilt table. That's the first time he stood, and then now he's up squatting, walking, doing hurdles, the works. So it's definitely very rewarding now.
In terms of kind of the usual like presentations that you would see, are there usual presentations that you would see, or is it I'm thinking even in terms of, do you generally see more younger patients than older, or is it males versus females? What would you say, or is there a
It's a wide variety of everything. Normally we would see quite a lot of sport related injuries. We get a good combination of sport related injuries and then just your non-sporting related like lower back, neck pains, overuse type injuries as well. But at the minute, obviously, sport's not happening, so we're seeing more people who post-op knee hip replacements. We'd always would have seen them, but now because the waiting list and people aren't getting the kind of access to the rehab they would have had before, we're seeing more of that. And with people working from home, we're getting more neck and back related injuries because their office setup might be not quite the same. And some people, when they're honest with me, they're sitting on their sofa with the feet up doing their work. So it's not ideal. And there's studies, I put a thing up recently, there's studies to show that people working from home are taking less breaks. They're just working through their breaks. They're not taking their time off or booking annual leave because they're at home anyway. So they're actually working probably longer hours or sitting for longer hours. They probably go from sitting at a desk to then sitting on the sofa to watch TV. They're not getting enough movement, which is then creating these problems. So we're now seeing a lot more of that. So it does change. It depends on the time of year, but also the circumstances like this as well for who we
I
see.
suppose that's actually a really interesting, perhaps knock-on effect of COVID. Again, that idea that you're right. I know myself. So when I was working in Scotland, I was actually working from home from March till September, and certainly that idea that particularly there, the restrictions were that you were only allowed to go for a walk kind of once a day as well, and you weren't allowed to go too far. So you're right,
Yeah.
I was, and actually in my context, which I imagine maybe a lot of people are, I didn't have a room that I could set up an office in. I was in a
Yeah.
one bed flat and I was working at a breakfast bar on a breakfast stool and then going and
Yeah.
sitting on the sofa. It just wasn't good, and absolutely I
Yeah.
could feel the impact of that on my body. And I think
Yeah.
initially whenever COVID hit, we didn't think it was going to be a long-term thing. We thought it was going to be, a few weeks, a few months, and that'll be it. But I think we've gone on for a long period of time now where people are working from home, and I wonder if that's something then that you might see more of,
Yeah.
those kind of injuries related to that.
Yeah, it's at the minute it's huge. I'd say the majority of injuries we're seeing are because of that. We've had different places contact us to give advice and videos. That's why we posted quite a few videos recently on the exercise to do at home, because their employees are getting so many neck and back related problems. So, I think we're seeing it now, but I do think it's going to be continuing to become a big problem. I think when they get the option, there might be people that still want to stay working from home for the long term, and but I think it needs to be monitored. It has to be something that they need to have the right things in place when they are. So yeah, definitely. But you seeing more people who are struggling mental health wise now that they're not getting out?
Yeah, I think so. I think we're seeing two things. We're seeing mental health people who maybe have never really had mental health difficulties before suddenly impacted by feeling down and depression and things like that. And for us, it's about trying to normalize that. That's a really normal response to what we're experiencing now. But what we're also seeing is people who already have mental health difficulties, they're becoming a lot worse.
Yeah.
Because of things like you mentioned there, like they're maybe not getting access to the full range of supports that they usually would.
Yeah.
So there was a while where, for example, we couldn't go out and visit anybody in their homes. or you can get support staff in like that. So
Yeah.
if you've got somebody who usually relies on support coming in, then they can only kind of go to the front door to meet them. They're not allowed into the house and all those things.
It's tough.
It has
Yeah.
a huge impact, like, and then just a lack of staff in order to deliver services and things like that.
Yeah.
And I think this mental health wise, it's an impact we're going to see for a long time.
I think so. Like we were only really locked down for work wise for 3 months. We were closed for 3 months back in March, and obviously then you couldn't get out and do too much. And for me, from my side of it, from mental health wise, I went from being flat out busy all the time, non-stop, to suddenly within a day, bang, stops, and I had to stay in the house. And it's tough, very, very tough. I had to try and look up different ways to kind of manage, because I was going around. I would have done Justin's heading. So I still do, but then
I was going to
but
say
but I actually started doing meditation over, and I'd never done it before, but I was fairly open-minded to it, and I actually found that really helpful. And I was out, my neighbors actually were laughing because the amount of walks I was doing through the country, they were like, geez, what's going on?
That's it. I know, but all we could do at one stage was walk, so that's what everybody was,
I know.
doing. But
I know.
no, I think you're right. I think there's something about how it happened as well, that it was such a sharp, all of a sudden, as you say, 1 week you were in work and planning for the rest of the year, and then all of a sudden you have to stop and you just can't go in.
Yeah.
And so the unexpected nature of it, and I think mental health wise, what people don't maybe realize is not only are all these like restrictions being put on us, but they've all, so our mental health is impacted because we're of that, but we're also not able to do the things. We're working more, but we're not doing the things that we would usually do alongside work, like meeting up with friends and family, going traveling, all those things. So it's almost like a double whammy.
Yeah.
So it's very much trying to normalize, that's a normal reaction. And like we've used words like it's a crisis, it's a pandemic. People have to bear that in mind when they think about how they react. Of course, you're going to react kind of drastically to that. That's normal.
Yeah, I think you're right. That's going to have a big effect long term. I think with the furlough scheme ends in March or something like that, and I think they're going to see it's going to get tough for companies and people losing jobs and stuff. So I think it is going to become a big problem. But if people have places to go and services to get to, then I would definitely go ahead with it rather than suffering. Yeah, definitely.
In terms of like, I suppose thinking, I know myself from a psychology perspective, the services like our NHS services and HSE down south are totally overwhelmed. So I suppose that's one of the frustrating things for me as a therapist, is that I can see, say, even if you meet people, kind of friends and family or in your social circle that need help, they then have to wait nearly 2 or 3 years in order to even be seen by anybody. And I suppose that's one of the good things about then having private practitioners that can also but the flip side of that is, are people in a position to afford that as well? And trying to balance all of that. And I wonder, in terms of physiotherapy, is it the same thing? Are there waiting lists and those demands there?
The wait for things like operations, so hip knee replacements or any kind of general knee arthroscopies or anything like that, they've gone way up. So like they were always quite long anyway. Now they've gone even higher. So so we're seeing people now who are getting frustrated with that, who've come to us for advice and do a bit of rehab, but also possibly looking at the option of going privately for operations if they needed it. So we're seeing that. Physio wise, then the physios in the hospital in our area, MSK, mostly, I don't know if that's changed recently, but mostly we're doing like phone call reviews with patients. They were seeing like emergencies or some patients face to face, but I don't think many. So yeah, the waiting list then for people who are wanting to be seen is probably quite high. I actually don't know what it is at the minute in the NHS, but I think if they're getting phone call reviews and they feel like they might need more, then it's tough to get that at the minute, which is understandable. They're absolutely snowed under. So we're definitely seeing people then who've been waiting and they've come to us instead. But I do think that's going to get bigger. I do think the waiting lists are going to go higher as well over the next while. It's just the hospital and NHS just can't cope. So
and that's it. I think it's I'm always mindful when I say things like that it's not about because I think there's lots of great people working in the NHS. They're just working in a system that isn't funded enough to do what it needs to do.
Yeah.
But I think I suppose I wonder what the impact that has then on kind of physio patients if they have waited for a long time, and I do think, if somebody's waiting now, the waiting time has probably even gone up. Rather than going down, it's gone up because of COVID.
Yeah.
I suppose whenever you see people, then is that when that frustration kicks in because they've waited for so long?
Yeah, generally, and the same as what you're saying. Like, we have a lot of friends who work in the NHS as physios, and they're fantastic. So, and anybody comes to me if they are seeing the NHS physio, we would try and work together on it. And it's not that I would never tell someone they need to come to me and not to them. Like, it's not that. I would try and work with them if they're looking for that extra bit of input as well as having input from them. Then that's brilliant. So I think they're fantastic. But like you say, they're under pressure now, and they've got they were always under pressure, but now it's got a lot harder. So for us, definitely, we do see that people are getting a wee bit frustrated with having to wait. I think people that have had to wait and then they're now getting a telephone call, for the physio. I think that sometimes can become a wee bit of frustration because it's not what they've waited for. Maybe if they've waited for, I don't know how long, months or a year for some kind of input, and then they get that. It's great, and the advice that you can give over phone is fantastic, but sometimes people need to see someone face to face to get that reassurance, and then have a look and go through exercise, and they need that contact a wee bit closer. So for them people, I think they get a bit frustrated. Yeah.
And understandably so, I
Yeah.
guess, given the
Yeah.
weight and things like that. Yeah. Is there anything in particular you wanted to ask me, or?
That was it. You say you worked with physios before, you were in the past as well. And what kind of stuff would you have seen then, mostly with them?
So I did a bit of work in the occupational therapy, and so there was a psychology, physio, psychiatry, and we were working with all the staff who worked for the NHS. So it was mostly kind of work-related pains and stuff, or whenever one of the main areas that I worked with after that, actually, sorry, which is what I had messaged you about, was a lot of kind of chronic pain, like working with chronic pain. And I suppose it was for me, I always found it interesting and sometimes quite challenging in terms of
Yeah.
understanding, like, when do we say this is a physical pain and when is this largely psychological, and how do we separate those two things out? And I, like, from my perspective,
Yeah.
I don't have the knowledge or the training or anything to know what is and isn't physical pain. So that's whenever I would be bringing somebody else in to say, what's your assessment? I suppose it's like doing that. So I've got my assessment, they've got theirs, and then sitting down together, and very much so trying to include the person as well and saying, look, this is what we think. But trying to separate those two as a psychologist, if it's not in your mind, it's beyond me.
But it's good. It is good to know when they bring someone into it for that. That does help. And I like I say, I don't think that happens enough here. We do refer on to other places, but I do think that we could still have a better understanding of what they all do. So so I think things like this are really good to help that.
And I think that's the thing for me too, is often whenever I see people, they're working and maybe they're involved in a number of different services, but at no stage do those services ever come down and sit together, like that. I suppose the NHS, for example, allows you to do that because you're all under the one kind of umbrella organization, but when you've got different services all working together, it's very hard to get together and give that person like a fuller picture. But I think for me, I suppose working privately, that's something that I'm trying to do as well, is say, like, even for me, for example, when I see people, I'll ask them for their GP details. And sometimes, what I see more of now is people saying, like, actually, could you ring my GP and let them know that we're working together, because they want that,
Good.
everybody knowing what's
Yeah.
happening, kind of thing. It's good for the patient, it's good for me,
Yeah.
and it's good for the GP to know as well.
Yeah.
So trying to kind of encourage that as well as much as possible, and very much doing it like transparently. So I'm not writing anything to the GP without them seeing it.
Yeah.
There's nothing going on behind their back, but it's just about, here are all the health professionals that are involved in your life, and we're all on the same page in terms of what's happening.
Yeah.
So I'm starting to see a little bit more of that, which is a nice thing, I think.
Yeah, I think it's great. I do think in private setting it should definitely happen more. I think it would help patients in general. If you are, and not just with psychology and physio, I mean, like, even broader than that. I think it could help nutritionists, dietitians, everything like that as well.
Absolutely. And I think it's just a case of it's much harder to do in a private context, because you have to kind of work hard to make those links, and we're so busy doing lots of other things as well.
Yeah.
But I think I'm starting to really value it when it does work like that.
Yeah.
You can really see the benefit, and for everybody involved.
Yeah. Yeah. Oh, it definitely is. Yeah.
One of the things I was going to ask you is in terms of, I suppose one of the things as a psychologist I see is that people often come when they're on a lot of medication.
Yeah.
So antidepressants and things like that. Some people are very comfortable being on them. Other people say like that's one of their goals for therapy is to get off of the medication, and so would do that with their GP or psychiatrist. In terms of a physio element, do you often see people coming on a lot of medication, maybe prescribed, or sometimes I imagine not prescribed as well?
Yeah, definitely. It's recently that again, that over the last few years, it's something I've kept close eye on. It's just the knock-on effect long term and the health effects long term of being on some medications just isn't good. So we always ask them anyway what medication are they on. But I would monitor that. So I would say to them, look, we want to try and get off this. If they've been on it for a long time and the pain levels haven't changed, then sometimes I would say, well, I think we need to get this reviewed straight away. If it's not helped you, what's the point of still being on it? So in my eyes, as soon as we can get off some medication, the better. And as soon as we can get people exercising, there'll be a release of natural endorphins and opioids, which will help with pain. And if we can do it with natural ways, that's much better for them physically and mentally. So my aim is always to get them off as soon as we can and find alternatives, whether it's ice or heat. And again, there's loads of evidence for both or against both. But if whatever works for the patient, if we can do something like that rather than them popping tablets, then I would be much happier with that one. Yeah.
I think that's the same. You see, it's the secondary impact then of a lot of that medication. And actually, it's always a really interesting one for me when I ask people in that assessment phase, what medication are you on? And I always say, like, not just for your mental health, if you don't mind sharing with me, otherwise. And another really interesting one is I've started to ask people if they take any supplements.
Yeah.
And sometimes you see people rhyming off loads and loads of supplements, and I think like, well, maybe that's telling us that there's something else missing here, and I don't know if getting it out of a tablet is the best thing.
Yeah.
And again, that for me is where I would be then kind of saying, maybe go back to your GP and get your bloods done and see, do you need these things, or is there a dietitian or something in the GP practice that you can speak to? But it gives us a really interesting kind of insight into where somebody's at often when we ask about medication. I think.
Yeah, I agree. Especially if you've had someone that's been on medication for a long time. You kind of get an idea of, it'll probably take a while to get them away from the medication, but it gives an idea how chronic the problem might be. So definitely.
And again, I suppose that's that element as well of like they might be quite anxious about coming off of the medication. Then that's what you're working with as well, trying to explain. And I think a lot of it, certainly in my role and from what you've said today, I suppose as well as that education.
Yeah.
Around, and I think that's a lot of people sometimes get stuck into doing something by habit, like they just start doing it, they've always done it and they don't think about it, but sometimes that education is so important.
Yeah, for us, like we would see people taking anti-inflammatories or quite high level pain relief. It's for the anti-inflammatory side of it. If someone's been on it for a long time, I would sit down and actually explain to them what the anti-inflammatory, the purpose of it is. And then when you explain it to them and explain why they should start come away or look to come away and go on to something different or speak to their GP about going on to something different, I think they do when they have an understanding of it. Maybe it helps. So the education side of it for that as well. Like I'm not a pharmacist, I'm not a GP, but we know that they're not good for them. So if we can try and get them and direct them back to the GP and advise it, we can maybe try and drop it down if we can. Then it can help them long term. Yeah.
I suppose one of the kind of last kind of questions I had in mind to ask you was about kind of, if you didn't mind, in terms of what got you personally into physio. I know you mentioned a little bit of it before, and I think I might have some idea, but I suppose it would be helpful for anybody who doesn't know in terms of what got you.
I was useless at football, so no, I played when I was younger. Football was everything to me when I was playing. So I'd never really thought past that. I was like most teenage boys. I was thinking, right, I'm playing for Man United in a few years' time. That's where I'm going. And then I broke my leg when I was 17, 18, probably at the age where I was kind of playing pretty well, but still miles off where I thought I was going to be. But broke the leg and had to go, right, what's going to happen here? I need to start looking at different options. And obviously then I was getting rehab for my leg itself. I was looking into it a little bit more and started getting that interest, and obviously saw how I could use that to stay involved with football and sport in some way. So that got me interested in doing the course. And then it always stayed with me, the sports side of it. So when I left university, I knew again I wanted to stay in that side. I was lucky then to get involved with. I got a job with a company that had come from a football background, set up a few private clinics, and still involved with a lot of athletes. So I got a job with them, and they trained me up and got me going. Stayed with them for 3 or 4 years. kind of worked my way up through there. And once I became a clinical lead with them for a while, I decided I would come back home and settle down. But never actually got involved with the football team. But that was just because of whenever I got to see actually what football physio was like, it's not the glamorous idea of what you think it is. So it changed my mind a wee bit, and I had to start looking at different ways to do it.
Yeah. And I think that's the thing. I suppose I wonder if that personal experience for you is quite helpful when you are working with people. We talked earlier about people who get frustrated quite easily. Being able to say, like, actually, I do understand what this is like for you.
Yeah, it definitely is. And it's funny because I put a post way back, I don't know, a couple of years ago about my own experience and my own injury. And I've actually had people, when recently I had somebody booked in with the same injury that I had, and that's the only reason that he booked in, because he said, you're going to understand where I'm at. So it definitely, and I do. And since then, I still play football and I do still pick up injuries and niggles. I pretty much had most injuries that you can imagine. So I like to say that I do that just to get a bit of experience of them all. But
yeah, but it's that like relationship was probably built a lot easier because you had shared experience, and
yeah,
kind of I suppose sometimes as a psychologist it's very hard for me to get that balance of kind of not oversharing, and I imagine it's a little bit easier perhaps in your context, but I still think we need to kind of share some of ourselves in order for people to build that relationship with us, or know that we do actually understand
yeah.
what you're going through.
Oh, I completely. I'm fairly open with my patients about the injuries that I've had and the kind of stuff that I do, and I talk to them about how it's hard to keep motivated for playing. There's a lot of boys or girls who come into me and they're footballers who find it hard to do the rehab because there's no actual start date for their football again, so they're kind of like a wee bit frustrated at the minute. So I'm the same. I had an injury before the last lockdown, and my rehab had gone really well, and then it locked down again. So I've been in the same pattern as them, and I've just talked them through. Look, I've been exactly the same, but this is the goal, and we have to kind of focus on that. So yeah, having that myself definitely helped with it, for my understanding, but also to build that rapport with them.
Yeah. In terms of kind of your practice and kind of moving home, have you found it different working in Northern Ireland compared to working over in England?
Having a way, like it's been that long, to be honest. But the clinic's opened 7 years, so before that, yeah, we are seeing different types of injuries. It's funny because initially when I came back, the perception of physio here compared to England was a bit different. Here, definitely, there was a lot more people who would come to me and say, "Can you pop the muscle in? Can you do this?" And what was the one we were laughing about the other day? Odorment, which is like used on cows, people are using on their legs. And one of the new physios that joined us, yeah, it gives you like a DP type feeling. But one of the physios that joined us came from Sydney, and one of his patients asked him, "Can you use that?" And he was like mind blown. He was like, "What are you doing that for?" So like, yeah, there's still old things that are used here. Like it's still, and people do think that you're going to pop muscles in there, you're going to pop a joint, or you're so here that was definitely much different than England. They weren't really like that, I think. They were just a bit more aware of what physios did, but not as much now. Like when I first came back, though, it definitely was.
Yeah, I think that speaks to the importance of services like yours, where it's about getting education out there, and I think that's something I've definitely noticed in terms of the social media things that you put out. A lot of it is educating people about
Yeah.
things, and that's such an important thing. Even breaking down these kind of misconceptions about coming to physio and all of that. And it's one thing to do it with somebody that's in the room, but it's another thing to try and put the word out there that this is actually how this works.
Yeah, it's tough. Social media is a good way for us to do it. I try not to be too opinionated on our views. There's so many different ways that physios can work, and I always say to anybody, I don't shoot down any of it. If it works for them, then that's great. I know it works for us, and we go with that. So I'm not too opinionated on it, on what we do. I just kind of let people know, and I share a lot of kind of stats and studies that are done on things, and I think that helps educate people, especially there was recent ones about the back that I put up, but people would have had this perception of the back in the past, and now there's a lot of studies that kind of go against that. So I think it's important to educate through social media as well for us.
Yeah. And in terms of kind of from I suppose a research perspective, you're saying there about kind of studies and stuff like that. Do you think is there much kind of research being done in I suppose Northern Ireland specifically, or is there much opportunities for that? Do you think?
I haven't seen much done in Northern Ireland, but there's some fantastic places in the south and around Dublin. There's a place that I would follow closely, and they're coming out with some brilliant studies, and they're actually kind of leading people from the UK send their athletes here to Dublin for assessments and rehab because of how advanced they are. So they're becoming really good. Doing research myself, I've never been that interested in it, but I've always watched and followed research really closely. So, but yeah, here in Northern Ireland, there's not that much that I know of. There's no centres that do. There's a new place in Belfast that's doing well with sharing a lot of information, a lot of studies, and putting a lot of stuff together. So I'd follow them closely as well.
It's always interesting because I'm not one for stats, trying to do research and stuff like that. But I'm like yourself, I'm always kind of reading and trying to keep up to date with stuff, and it's always interesting to see like is there much
Yeah.
happening. And I think there's one of the things I found from moving from Scotland to Northern Ireland is that there definitely is a lot more kind of misconceptions here about therapy, all types of therapy, and I think it's a little bit behind in terms of when you compare it to Scotland and England. And I don't think it's anybody's fault. I think for whatever has happened, that's just how things are. But I suppose that's for me as a psychologist is the importance of trying to say to people, well, look, let's see, let's get as much like genuine, proper information out there as we can. And again, that's part of the reason behind the podcast was like, let's have these conversations and let's let other people hear them.
Yeah, and that's the same as us. We trying to share as much evidence-based exercises or rehab or advice that we can. There is a lot of stuff on social media that gets a lot of likes, that's not very evidence-based, so there's treatments out there that hasn't got strong evidence, but yet it looks great on a video. So we try and share anything we put up. I always do the background research in it, or I've done background research in it before, and then share the research that it is, or tie it into it as well.
Yeah, I think that's really important, as you say, that kind of if you're going to kind of buy into something that you see in social media, knowing that actually it's coming from a good source.
It can be dangerous. Social media can be fantastic for educating, but it can also be dangerous for educating. It can feed the wrong type of information out. So yeah, I think that it has to be used carefully, definitely.
And I was just going to say, in terms of it's good to hear that you're still open through this lockdown, and hopefully we'll not have many more lockdowns. It's hard to know what way things are going to go. But how would people get in contact with you if they are looking to make an appointment, or what way does it work?
So they can call us directly, or they can go through our website, Facebook, Instagram, or email. So loads of ways. We've recently set up our online booking, which they can get through our Facebook, Instagram, and website. I think you can get it all three. Or they can call directly through to the clinic, which they'll get the number on them pages as well. And generally it's Justine that they'll get speaking to, and she'll get an appointment. We have two places now. I'm here in Foyle Arena here today, and then our main clinic, the one we've had open longest, is over in Grey Steel. And we've got a few physios. There's myself, Paddy, Katie, Shannon, Justine's in our practice manager, and Karen has joined us recently. She's a pelvic health specialist as well. Okay. So there's different options depending on what people are looking for.
Yeah. So does everybody do something different within the team, or is it a shared?
We all focus on MSK. Mm-hmm. It just depends on people's preference. If they'd like to see a female, there's two female options there. A male, there's two male options. And then Karen's specialized in pelvic health. So me and Paddy would do acupuncture. So if people look for that, then we would do that as well. And what about you? Do you get your appointments mostly privately?
Mostly it's so I'm running a clinic out of Derry, out of the Centre of Wellbeing, which is just on the Foyle Road. So I just recently went there to rent out space there. It's a beautiful, really nice building.
I've seen it. Looks class.
Yeah, nice and calm and kind of atmosphere, lovely rooms and things like that. So I'm working, well, at the minute I'm doing all online, just in line with like the restrictions and things like that. And then I'm also running a clinic in Buncrana as well. Good thing for me as well is because I'm able to do online, like yourself, you said at the start, I'm able to see people in Scotland and England as well. There's definitely, I was really resistant to doing telephone calls when lockdown first hit. I just thought it's not the same, it's not going to be good, but actually it works. My preference would still be for face to face, but I just think the fact that we're even able to offer it to more people,
Yeah.
that you don't have to be local to use the service, and then video calling as well. But interestingly, I found most people would rather do phone calls than
It's a
video.
great option.
Yeah, I
Yeah.
think maybe because from my perspective, it's very intense to sit like staring at a screen for somebody when you're talking about something very emotional. Usually when we're in a room, we're usually looking past each other or looking out a window or something. So there's not that intense, and you can do that on the phone. Whereas if you're sitting face to face, it's very,
That's true. Never thought about it.
yeah. So I think
Yeah.
that's a big difference. But
Yeah. And how do
but no, it's
people
great.
how do we refer like or book people in with you? Like how do we direct them to book in?
Yeah, so just through the website, which is just
Yeah.
patriciabarbertherapy.co.uk, and then I've got a Facebook and Instagram page as well. So all my things are Dr. Patricia Barber.
Yeah.
And people can just contact me directly, or you can contact
Perfect.
me
Yeah.
to send people over. But yeah, and there's loads
Yeah.
of good help out there. I think one of the difficulties is people trying to find it.
Yeah, I think that's it because Derry obviously has an issue in mental health. So if the last couple of years, I think there's been more that's come out and more people. There's a couple of fantastic schemes that have been set up. So I think there's a few things out there that are really good, but it could still do with increasing the awareness of it all, definitely.
Yeah, and I think it's one of the biggest things I found is there's loads of really good things already existing, but people just don't know about them, and it's trying to get people connected to them.
Yeah.
Which is helpful. But hopefully it's all moving in the right direction.
Yeah, I think it is definitely.
Well, that's great. Thank you very much.
I didn't ramble on too much.
Not at all. It's really interesting though to because I mean that when I say I feel very much like I'm in a bubble of just psychology, and it's it's really important to kind of get outside of that and hear.
Yeah, it's good. It's good to chat about other people's professions and how they see it tying in with ours as well. I think that's interesting. Yeah.
Honestly, thank you so much.
No problem.